The results of Dartmouth's groundbreaking clinical trial of Therabot, a generative AI-powered mental health chatbot, could signal a new era in the accessibility, scalability, and personalization of mental health care. Conducted with a rigor rarely seen in the digital therapy space, this trial is the first of its kind to clinically test the therapeutic capabilities of an AI chatbot, and the findings are nothing short of remarkable. Participants with depression, anxiety, and even eating disorders experience measurable and, in many cases, profound improvements in their symptoms. For many, the software provided a sense of connection and trust often reserved for human therapists. These outcomes suggest that AI-assisted therapy may no longer be a futuristic concept. It may be an imminent tool in the evolving mental health landscape. In a country where demand for mental health services far outpaces the availability of trained professionals, the implications of this research cannot be overstated. For every licensed mental health provider in the U.S., there are an estimated 1,600 people struggling with depression or anxiety. Traditional therapy, while essential and irreplaceable in many cases, simply cannot scale fast enough to meet the urgent and growing need. That's where innovations like Therabot step in. In the study, users were given unrestricted access to the chatbot via a mobile app, and over 8 weeks, they reported statistically significant decreases in depression and anxiety, with depressive symptoms dropping by an average of 51% and anxiety symptoms falling by 31%. These numbers are on par with, or in some cases, better than what patients report after in-person therapy. Importantly, nearly 3/4 of the participants using Therabot were not undergoing any other form of treatment at the time of the trial. This highlights a key strength of AI-powered support: its ability to reach people who might otherwise fall through the cracks of the healthcare system. These users weren't simply passive participants. They engaged with Therabot as if it were a companion. They initiated conversations at odd hours, turned to the app during emotional moments, and some even began to treat it like a friend. These were not fleeting, robotic exchanges. They were meaningful, evidence-based interactions shaped by established psychotherapeutic techniques. Therabot's language models were trained using best practices from cognitive behavioral therapy and other mainstream therapeutic approaches. This means its responses were not ad-libbed or generic, but based on structured, clinically validated frameworks. The AI was designed to listen empathetically, guide users through introspection, and provide gentle but effective strategies for reframing thoughts and emotions. Most impressively, these exchanges didn't just feel therapeutic, they were therapeutic, resulting in symptom improvements that surpassed what the control group experienced. That said, while the optimism is warranted, the study's researchers have not shied away from acknowledging the risks. As generative AI becomes increasingly convincing in its human-like communication, the danger is not in whether it can engage users, but whether it will do so in a manner that is always safe, responsible, and therapeutic. The very openness and adaptability that make these systems powerful are also what make them potentially dangerous in the absence of proper oversight. For instance, if a person expresses suicidal ideation, it is imperative that the response is immediate, clear, and safe. Therabot has built-in protocols to detect such risk and redirect users to emergency services or crisis lines, but any lapse in that safeguard could be catastrophic. Even one inappropriate or misunderstood AI-generated response could turn a vulnerable moment into a crisis. The key message from the researchers is that AI therapy cannot be allowed to operate fully autonomously, at least not yet. Despite Therabot's success, its creators emphasize the absolute necessity of human oversight in the development and deployment of generative mental health technologies. Mental health is not a space for tech experimentation without consequence. It's a field where every word, every inference, every suggestion matters. That's why rigorous testing, ethical design, and ongoing clinician involvement are non-negotiable. Nonetheless, the positives of this study shine brightly. What we're witnessing is not just a technological milestone, but a psychological one. People who may not have access to a therapist due to geography, financial constraints, or stigma now have a potential lifeline. They have a tool that listens, adapts, and offers real-time support in moments of need, day or night. For those managing chronic conditions like depression or anxiety, that kind of availability can make the difference between deterioration and stability. Therabot doesn't replace therapists, it augments care. It fills the spaces between appointments, supports users during difficult nights, and encourages engagement with mental health practices in everyday life. The chatbot isn't trying to diagnose or cure on its own. It is part of a larger system that, when paired with professional guidance, can help millions get the support they need sooner and more frequently. This study from Dartmouth sets a high standard. Unlike many tech initiatives in mental health that are rushed to market with little accountability, this trial was conducted with care, transparency, and a deep understanding of the stakes involved. It's a model for how generative AI in mental health should be pursued deliberately, ethically, and with patient well-being as the foremost priority. As the mental health crisis continues to unfold worldwide, particularly among younger and underserved populations, Therabot and tools like it may not just be helpful, they could become essential. But we must proceed with both excitement and caution. While these early results are promising, future iterations must be stress-tested across diverse populations, diagnoses, and cultural contexts. And most importantly, they must remain tightly linked to the clinical standards and human judgment that define truly effective care. This isn't a replacement. It's a bridge, one that might finally help close the gap between those who need help and those who can give it. If we build it carefully, with safety and empathy at its core, AI therapy could be one of the most transformative advancements in mental health support we've seen in decades.